I'm selecting Cedars-Sinai. And at the bottom of your screen, you'll see Profile Summary page. By clicking on the Profile Summary page, you will see all of those different data fields that were in that questionnaire. They're populated for Cedars-Sinai. So you see at the top we're dealing with Cedars-Sinai Medical Center, and you see that it's in Los Angeles County. It tells you which congressional district it's in, which state Senate district it's in, which state assembly district it's in. It gives you information about the number of licensed beds it has. It tells you what type of ownership it has. And these are all relevant because, as we'll work on later on, you can sort in a variety of ways on this pivot selection page, which will let you compare Cedars-Sinai to its peers that are large hospitals, to its peers that are nonprofit hospitals, and to other hospitals as well. So licensed beds gives you a sense of the number of beds that the hospital is licensed to operate, which is different from the number of beds that the hospital actually operates, if that makes sense. So just because a hospital has 900 beds that it's licensed to use does not mean that patients will fill all 900 beds every day. So the licensed beds is simply an indication of the number of beds that at maximum that the State Department of Health Services and Public Health, the State Department of Public Health allows them to operate. The patient days here is an indication of the number of days that those beds were filled. And if you look here on the other side, where it says licensed bed days, this is if every bed was filled every day, the number of bed days they would have. So you can see here that when you divide the number of patient days by the number of licensed bed days, that Cedars-Sinai has a licensed bed occupancy rate of 79.27% in 2009. Now, what you don't know in looking at this is that high, is that low, and we'll have some. I'll show you how to get some comparisons after we've gone through the sheet. It tells you the average length of stay in the various units, and it tells you the number of discharges. This is all for Cedars-Sinai. Scrolling down a bit, you're able to see information here about births, about the number of births at the hospital, 6,718, and the number that were C-section, the number that were vaginal births, and the number that were in an alternate birthing center. It does the calculations for you. And again, I'll show you how to compare that to other facilities. The other thing you can see here is live births by weight, and these would be low birth weight and very low birth weight infants, which helps you understand sort of the level of the level of services that this OB unit is providing, and whether it's caring for very low birth weight children, which could increase the amount of time in the neonatal intensive care unit. Before I go on, I just wanted to remind you, as Michelle said at the beginning, and as we said in, I think, the email, that you can feel free to tweet and share what you're learning using the hashtag OSHPD, OSHPD, during this call and after the call. So I hope you'll think about doing that. Going down, you can see emergency medical services, and this is a sense for you of the number of EMS visits at the hospital, and it will also tell you the number of hours and the percentage of the time that this hospital was on diversion. And remember, diversion is when you're close to ambulances. One unique thing about Los Angeles County is that hospitals are often on diversion, and so diversion loses its meaning, because if every hospital is turning away ambulances, basically it opens up all the hospitals to ambulances, because the ambulances have to have somewhere to go. So typically if one hospital is overcome, they would go on diversion, but if every hospital is overcome, they basically all have to take any ambulances that show up under federal law, which requires them to screen and stabilize all the patients that show up in their emergency room. You can also see here the breakdown of the EMS visits by acuity, that's by severity, and how that breaks down as far as the types of situations they were dealing with in the emergency room. As I mentioned, the issue of the emergency room visits that result in admission and what the percentage was at Cedars-Sinai was 27%. Remember that for Prime Healthcare, what Christina reported was that it was in the 60s, so it was considerably larger. And then there's a bit of information here, which is the visits where a patient left without being seen, which could be an indication that the emergency room is not well functioning if a lot of patients are leaving before they're being seen by a doctor in the emergency room. It's a sign that things they're either overcrowded or they don't have a very good way of moving patients through the emergency room, or very long delays. the bottom, there's a chunk of information about the services that are provided, surgical services and cardiac services, the operating room minutes, the average time in each surgery, and information about pacemakers and stents, and we'll take a little bit of a look at that going forward. Finally, at the top, you'll notice this thing that says security warning. Macros have been disabled. In order to really get the full use of this, you will want to enable your macros. And so you would just hit the options, enable this content, OK. And by doing that, for instance, here, you could click Retrieve Facility Names, and it will tell you that you're looking at Cedars-Sinai Medical Center. This is important because as you go to subsequent pages and you're looking at groups of hospitals, you may want to know which hospitals you're looking at that are grouped together, and hitting Retrieve Facility Names will get that list for you. So let's write down on our pads, if we can, a couple things that we wanted to see how Cedars-Sinai compares to other facilities. Just looking at the top, I'm interested in knowing about the licensed bed occupancy rate at other facilities. And so I'm going to write that down. And Cedars-Sinai is 79.27%. I'm interested in the C-section rate, and Cedars-Sinai is 39.19%. And finally, I'm interested in the percentage of EMS visits that resulted in an admission. And for Cedars-Sinai, as I mentioned, that's 27.75%. So how do you now compare this information? So we've seen what Cedars-Sinai is. How do we go about looking for other hospitals? We would go back to the pivot selection page, and we would first undo what we selected. So we would undo Cedars-Sinai and go back to all. So now this is exactly the way that we found the page when we started. And I'm interested in seeing, compared to other large hospitals, what is Cedars-Sinai, how do they compare? So in this case, I want to adjust bed size range. And I'm interested in hospitals with 500 or more beds, and I'm hitting OK. So the only thing I've done here is that's the only sort of subset I do. Now, I could go and refine this in many different ways. I could go and say I'm interested in only nonprofit hospitals that have more than 500 beds. Or I can say I'm interested in only hospitals in Los Angeles County that are nonprofit that have more than 500 beds. I don't want to do that, so I'm going to go back to all so that I don't tamper with the experiment I'm trying to do. One note about type of control, for those who aren't familiar, hospitals generally are nonprofit or for-profit. So here is the nonprofit, and investor is for-profit. They can also be owned by cities and counties, like Los Angeles County has a number of hospitals, the University of California. The state hospitals typically refer to psychiatric hospitals. I'm going to say all hospitals. After we've selected the data we want, we'll go back to the profile summary page, and you'll notice on here that it's now at the very top saying that we're looking at 18 hospitals. So there are 18 hospitals in the state of California that have more than 500 licensed beds. And by going to the bottom, sorry if I'm giving you whiplash by scrolling so much, you can see what the list of those hospitals are. So these are the hospitals that in 2009 had more than 500 licensed beds. And again, that doesn't mean that they were 500 operating beds, just more than 500 licensed beds. So let's see how Cedars-Sinai compares to the broader group of large hospitals on the measures we looked at. So going to the top, you can see here that among the licensed beds that were occupied, where Cedars-Sinai had a licensed occupancy rate of 79%, the broader group only had an occupancy rate of 67%. So Cedars-Sinai was considerably busier and had fewer bed vacancies than its peer hospitals. We also saw that Cedars-Sinai had a C-section rate of 39%, and you can see here that the C-section rate for its peer hospitals was 32%. That doesn't tell you the whole story. It's just a nugget of information. But sometimes by looking at this and trying to compare facilities to their peers, things will jump out at you as being huge outliers. That's a reason to ask questions. It may not be a story in and of itself. Finally, looking at visits to the emergency room and how they resulted in admissions, you see for large hospitals on the whole that the percentage of total EMS visits that resulted in admissions were 19.86%, whereas Cedars-Sinai was 27.75%. And once you know that Prime Healthcare's figure was 60%, you start to see that there's wide variation in this. One thing I'll tell you, is, in being somewhat familiar with this information, is that when you look down here, you'll see that a number of the largest hospitals in the state are publicly run, and they serve indigent populations. And those tend to be facilities that will try not to avoid having an EMS visit resulting in admission, and I would suspect that that plays a role in seeing this figure be lower for the broader group than it is for Cedars-Sinai. So you can take this information and going here and just keep changing it up and looking for what you want to look at. I'm taking it back to the original report, but you're able to go here and compare teaching hospitals to non-teaching hospitals if you wanted to do that. You could look in different state assembly districts and Senate districts. You can take a look at whether or not the hospital is for-profit or not-for-profit, as I mentioned. And that will let you really begin to come up with ideas. I want to take you to the next panel here, because this is within this particular spreadsheet an opportunity to sort of look at how data is gathered. And so as compared to the other one, which lets you know which section of the report it came from, this does not do this. It's a long spreadsheet that goes all the way out to here. But, and I'm sorry again if it's dizzying, but what it's basically all of the information that is populating the cells within the profile summary page. And you can take a look here if you wanted to do that. But before, instead of doing this here, I thought it would be beneficial to actually take a look at it within the page that's the broader database, because here it functions by referring back to the section of the report so that you can directly see within a facility what it is that they filled out and how they filled it out. One neat trick that you can use in looking at things on Excel, particularly when you're dealing with a big file, is when you're going over here and I'm in this table, and now I've already forgotten what is line 14, which hospital is on line 14. So one really useful trick of the trade is to go here and to figure out what it is that you want to show up on every screen. And in this case, I want this to show up on every screen, which is the hospital name, and I want these top information, the sections, to show up on every screen, no matter how far I go this way or no matter how far I scroll down. I want the information at the top and at the left to show up. So what you would do is set your cursor in the first cell, both below and to the right of the data that you want to stay in place. And you would go on top, under View, to Freeze Panes. And by freezing panes, you'd click Freeze Panes. By doing that, watch what happens. As I scroll further and further to the right, that information on the left stays where it is. Similarly, as I scroll further and further down, the information on the top stays where it is. So I always know both the name of the hospital I'm dealing with as well as the category that I'm dealing with. That's super, super helpful, and it will save you a ton of time of having to keep scrolling to the left and up in order to figure out what it is that you're dealing with, particularly in a large data set. So let's, just for the sake of this exercise, let's try to determine what is the largest hospital in the state as far as licensed beds. And so we would go back to this report and take a look and see which field that relates to. And as you see here, as you go down, I'm interested in Section 3, line 25, which is the sum of the licensed beds. So I'll go back to this file, and I would look for 3.25. And as you see here, it says hospital bed license total.